Hi, I'm Steve with Fitness for Five and the CEO of Fitness for 10 in Northern Nevada, here with Dr. Nario of Biointegrative Health Center. They're also in Northern Nevada. You can look them up online, Integrative Health Center, and it's a biointegrative health center. They treat all kinds of patients for a number of different things. I go there myself a couple times a week to get IV drips. So today I kind of wanted to talk about something that's more common than what people realize, brain injuries. You know, I played football when I was a kid. I played every sport. And any sport can kind of give you a concussion. You know, you're playing soccer, you fall down, you're playing basketball, you get hit in the head. And that can affect you throughout your life. So let's talk about the brain. So what would you tell me just right off the top about the brain? What is it? What does it do? Tell me about that to kind of go towards the answers or the help of the people that, you know, have kids that are playing or have had a concussion or a car accident or whatever. So tell me about the brain.
Well, first of all, Steve, thank you again for the invite. So going back to your question about the brain, so let's start this up. And it's a very complex organ in our body, but to make it simple, it's an organ enclosed in the skull or head and connected to the spinal cord, connected through neurons or nerves. And it's very supportive in terms of the structures that are around it, and also the nutrition of the brain as something that we always need to think about. And what we feed the brain, like of course, glucose is the main food of the brain, and it integrates sensory information when we try to get information in through touching and feeling, and of course, responses through motor responses such as movement. And we also respond through, of course, the heart rate and the respirations, all are involving the brain function. And here is the biggest part is always the brain processes, the learning, the executive functions, and how we make decisions. And compromising brain health is the one that we always need to think about. And the most common is it's always the lack of oxygen. And that's everything needs to be breathing, and that's the bigger organ that needs it. And what happens to this and what alters this, I guess, process, usually environmental toxins, pollution that we're exposed to, people who goes through treatments like chemotherapy, a person who had a heart attack or stroke, of course, circulation is impaired going to the brain, near drowning experience for a swimmer, sometimes when they, of course, have an accident in the pool, and chronic stress. Definitely when you have high cortisol, the brain definitely is not going to function right because the hippocampus is responsible for the memory becomes impaired. And aging, as we all know, is related to low blood supply and delivery of nutrients to the brain. And another one, which is important for, I guess, the athletes that we have out there, is trauma. And these are the concussions that occurs during these physical activities.
Yeah, who knows how many I had and how many different sports, but what is a traumatic brain injury?
Well, Steve, traumatic brain injury is a primary mechanical injury, meaning high impact, meaning actual physical injury. And the misconception here is brain traumatic injuries, the people think it's all depending on the intensity. You have to be tackled by a football player or be body slammed by a wrestler in order for you to have or to instill more damage to the brain. And but that is a good idea of it, and it's the most common reason why you get a concussion and the high impact. So sports, as I mentioned, but also think about car accidents or even just falling off a ladder can also simulate that. Extreme cases, though, these are the ones that I want everybody to think about, are even the light injuries can cause brain traumatic injury. So a good example for you is bumping your head on the garage door. And the thing is, if you're an elderly, you don't have all the protection of that brain. The brain is already fragile, meaning it can cause the same damage that a football player who got tackled by another football player and incurred the same damage. And all depends on the integrity of the protective structures of the brain, such as the skull, the fluid, the nutrients. Of course, if the person is ill, how old is the patient? And the most common talk that we should always affiliate with brain traumatic injury is always sports. And injuries can last maybe seconds, minutes, hours, but you have to remember it can also last for days, weeks, and months. And the better analogy for this is the ripple effect of the water. Damage has been done, it's not done yet, and it's ongoing for that long, injuring or destroying specific parts of your brain. And that's why it's all related to blood vessel injuries and the bruising of the brain, nerve injuries, and even axons or the connections of your nerves, and especially brain swelling. We see that a lot. And underneath it all, there's what we call metabolic disruption, meaning the processing of nutrients, slower energy production of the brain, inflammation, and continued cellular damage will lead to cell death, brain cell death. And again, when we have brain cell death, it's hard to get recovery. And ongoing damage after the initial injury is the one thing that we always have to think about.
Yeah, I know. I played college football and played a lot of sports when I was younger, baseball too. And you don't even, football, you don't even have to hit your head because
Right.
you said when a football player tackles a football player, well, gorilla tackles you,
Yep.
your head's going to do this. Well, your brain is smashing against your skull. You didn't even hit your head.
Right.
So it can be very subtle.
Mm-hmm.
So what are the symptoms of a traumatic brain injury? What are the symptoms? Is there a long-term symptom? Is there a short-term symptom? What are they?
Well, Steve, the thing here is that now you brought that up. Now we really need to emphasize helmets. That's why there's a reason for it, and people should actually be using it. But going back to your question, I wanted everybody to remember the great Ali, who's a boxer, now who has Parkinson's. Aaron Hernandez, the football player who actually ended up killing somebody and killing himself in jail. And another, I don't know if you're familiar with this, a wrestler, his name is Chris Benoit, who actually murdered his whole family because of a TBI. And the thing here is, all of these, the price of fame and glory, but at the same time, because of their jobs, they got the actual injury, and this what actually was the consequence of that. And symptoms of poor brain health, and this is what I want everybody to look into, especially athletes and people who are around these athletes. And if they develop, for example, headaches, unexplained headaches, anxiety, brain fog, memory problems, difficulty concentrating, trouble sleeping, tired all the time, irritability, emotional, depressed, dizziness, vision problems, ringing in the ears, sensitivity to light, noise, and extreme changes in personality, such as depression, psychoses, and mental illness. And again, you don't really know when these symptoms are going to pop up. Most of the time, as I mentioned, weeks and even months. So it might be deceiving that when the hospital tells you when you have a concussion, they only want you to stay for 24, 40 hours for observation because they're only looking at acute problems that might need intervention. But when you go home, there are more things to look out for, and it might be something that might come under the radar.
Okay, so you're telling me about specific symptoms and things that can identify this, but is there a specific way that we can actually detect brain injury? Is there a test, or is there a way to do that?
There are so many ways in how to do this, and it might become even way more technical if I explain it in a medical way. But yes, let me give you some examples, Steve, in relation to how the medical community uncovers this. You will always hear about CT scans, MRIs, even EEGs, eye testing, and only so much for the naked eye that can be seen in terms of the damage. But I have to explain to everybody that the damage here is microscopic. And it can't be even, these machines that I even told you about, or diagnostic tests, could even miss it. And even blood tests, there are blood tests. So when we do assessments, we definitely want to make sure that we do like growth hormone, even testosterone, cortisol levels, and even thyroid hormones, which are all going to be affected because it's the brain. And the brain, you have to remember, is the main machine of your body that creates all the hormones in the system. That's why it's a bad chain reaction of bad things that actually can happen to a patient. Again, all these things that I mentioned, the blood tests, the diagnostic tools, may or may not show immediately. And that's why conventional medicine can only take us so far in diagnosing TBIs. And I always have to say, TBI is more of a clinical diagnosis, meaning symptoms says more. And that's why education about people around these athletes is very important. And of course, the athlete themselves, that they have to see all these changes, especially the behavioral changes that I just mentioned a while ago, is the one of the most common things that I hear from my patients, that this is totally not the same person that I know about. And it all happened after that specific brain injury.
Hmm. Okay, so let's say we get a diagnosis and we know that someone has a brain injury. What can we do? Is there something that you can do, maybe at your clinic or somewhere, where you can actually treat this brain injury?
Well, again, brain injury, when you talk about injury, what do you need to do, Steve? It's all about healing and recovery. And we won't wait for tests. I mean, for me, I don't let tests dictate what I need to do for a patient. If I do see TBI, there's always should be a management ready. And the management here is to lower down the inflammation of the brain. And also, you want to achieve protection, meaning maintain whatever structure is already saved and prevent neuro, I guess, degeneration. And you want healing again or regeneration of these brain tissues. And earlier, here's what I want to contradict, because most of my colleagues would tell you after a brain injury, rest for 24, 48 hours. That is actually the worst thing that you could do. The thing here is earlier initiation of aerobic exercises is associated with a faster recovery of return to your regular activities for a TBI patient, meaning you go back to sports, you go back to school, you go back to work. So I'm not saying go back play football again, but the more circulation that you can bring back to the brain through walking, through running again, as tolerated, increases that blood flow to hasten the repair. And the thing here is each successive day that you delay exercise, the less favorable the recovery is. And so let's go back to the nutrition, as I always preach about. When head injuries are involved, you have to make sure that you eat small, frequent meals so that you can put fuel in there continuously every 3 to 4 hours, which is high in protein. Protein heals the brain. As we all know, we need amino acids, and fish, lean meat, nuts, eggs, and especially healthy fats and healthy oils, which includes avocados, seeds, and nuts, and even carbohydrates. Because I mentioned to you, what is the brain of the food? Glucose. And do it the healthier way by fruits and even vegetables. And as we spoke about diets in the past few weeks, the Mediterranean diet is the best way to heal the brain, meaning it's related to slower rate of cognitive decline. It reduces the conversion even to Alzheimer's disease in the longer terms of things. And it's very easy to do. And one thing that I can tell, not only for the athlete who gets brain injury, but also for the people around them, is fish oil, meaning the DHA in fish oil protects the brain from damage even after a stroke, according to a study. Given 3 hours after a TBI or a brain injury for 30 days, the injury actually had recovered or even was lessened. And omega-3, the wonders of omega-3 supplements, I cannot brag about it too much. It's one of my favorite supplements that I take. At least take 3,000 milligrams of EPA, DHA combined, or even as a maintenance. But in cases that I see like fresh brain injuries, we start cases even as high as 9,000 to 6,000, depending on the case. But the lesson here is, even without TBI, fish oil is good for cardiovascular health and brain health. But when injury occurs, you actually are protected. That's why taking fish oil prophylactically before the injury, or even you just taking it as a vitamin, is already protecting your brain. If you're a football player, if you're somebody who's in wrestling, any physical activity, that already is protecting your brain even before a TBI does occur. And other supplements that I can recommend for our patients would be taking CoQ10 to help the mitochondria, amino acids, as I mentioned a while ago, neurotransmitters for the brain. Vitamin D is known to protect the brain. Probiotics helps the gut and brain connection, and magnesium as a support for the nerve transmission in sleep, and glutathione as a potent antioxidant.
Wow. So you want to get back to normal as soon as possible. I hear that. Unless it's football, you don't want to go back and start banging your head on the wall, right? So I know that you do some treatments there that help inflammation. Is that something that would help?
Yes, so that's a pretty good point, Steve. So the IVs that we have here, such as number one is phosphatidylcholine. So phosphatidylcholine is a fat-based treatment. And that, as we all know, the brain has a lot of fat, and that's why even going to the point of omega fish oils, that will definitely recover the brain tissue faster because we deliver that through IV therapies. And also amino acid infusions would be a good one as well.
That's one I like. All right. Well, once again, thank you, Doctor. Dr. Nario, Biointegrative Health Center in Reno, Nevada. Thanks for being with us.
Well, Steve, thank you again. As we all know, the knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I always call the biological edge or the bio edge that we instill in our patients.
Thank you.